I'd had problems with my back from my early 20s. I turned a bath tap and looked behind my shoulder at the same time, and something happened to my neck. I'm not sure what, but I suffered with my neck from that time really. Periods of being absolutely fine, and then times when I was really very uncomfortable indeed. So uncomfortable that I would need to take painkillers. Those painkillers made me feel really quite poorly at times, made me sick, and that's just how my life was really for about 15 to 20 years, and it steadily got worse. Between sort of the ages of 30 and 40 it was progressively worse, and I spoke to my doctor, spoke to several doctors, spoke to people who did acupuncture, spoke to physiotherapists, tried various things, but nothing really seemed to make it go away. And finally I persuaded my doctor to refer me to a specialist. Went to see Mr. Krishna, who did an MRI scan, and the MRI scan showed that I had a problem in my neck with 2 of my discs. That was quite comforting, because then somebody could show me exactly what was wrong with me, stopped feeling like a complete hypochondriac, and he suggested that I had a cervical fusion, which meant that a cage would be fitted into my neck and some bone would be taken from my hip, and the cage would hold my vertebrae together while the bone from my hip was inserted into the place where my discs were. The discs were taken out and then the bone was inserted, and then that fuses those vertebrae together. That sounded quite significant at the time, and so I did a little bit of research and spoke to a few people who'd already had that operation and knew that it was a sensible thing to do. The day of the operation I just went in on the morning, and very swiftly people sort of talked to me about what would happen. Obviously went down to surgery, had a small incision in my neck and the bone taken from my hip. Obviously I was asleep while all of this was happening, and when I came back from surgery I had some staples in my neck, not stitches, some sort of staples going across my neck to sort of seal the wound. I had a drain from my neck that was just sort of there to make sure everything was okay, and the next morning they took the drain out and I could go home. I had the staples still in my neck, a couple of staples in my hip, and I was monitored just to make sure that the wound was healing correctly, which it was. There was no problem with that at all, and about 2 weeks later they took the staples out, and that was it basically. Since then my recovery has been brilliant. From that point I've had no recurrence of the spasms that I used to have, that were meant that my daily life was affected all of the time by the problems that I had in my neck. And now, sort of 6-7 months later, I'm going to return to all of the things that I used to enjoy doing before, but was always conscious of the fact that it could bring on a time when my back would be bad. So I'll go back to horse riding again, and just living a normal life.